to feel free to turn on your cameras, and we will get started in a couple of minutes. I see some of you are still connecting to your audios. Okay. And as said before, we strongly encourage you guys come to these webinars. You're required to come to every year. And this is the first one of this year. We'll be talking about public health, led by Miss Sonia. Again, the name of the webinar is Public Health 101. So yeah, I'm going to hand it off to Miss Sonia.
Okay, should we start? It's 5:03.
Yeah, I think we can get started.
Okay. So happy Sunday, everybody. I know some of you attended last year, so it'll be a bit of a repeat. The idea behind the webinars is to try to go a little bit deeper into some of the issues, right? So some of the work that we're doing through Hope Avenue, it's actually a field, which is public health, global health, psychology, sociology, and there's just so many different related fields, criminal justice, education, behavioral health, and you interact a lot even with like statistics, biostatistics, a lot of the sciences. And so I've been a public health doctor for about 25 years, and I'm specifically an epidemiologist, okay? So something like the pandemic that we're going through, which is an infectious disease pandemic because it's global, is preventable. And that's what public health is. So we'll go into, I think we have about 35, 40 slides. We'll try to make it interactive. If you guys have questions, maybe just raise your hand and we can address it, or hold off till the end of the presentation if you can wait. I'll try to simplify it, but hopefully it'll be informative for you guys. And like I said, I've been in it for a long time, and I feel like I'm still just getting started. There's so much need. There's so much we can do. And I'm just glad that you guys are learning about some of this much earlier than what our generation did. Okay. So this is kind of the agenda for the presentation. We'll talk about what is public health, why is it important, which is basically talking about the global burden of disease. What are the leading causes of death? What are the leading causes of disease? It includes all of the above, from your individual health, nutrition, physical activity, some of the chronic infectious diseases, to more of the environmental factors, right? Including climate change. That's also a public health issue. What perspectives should one use to consider public health issues? So what is sort of the overall framework that you use? How is it different from medicine? How is it different from sociology and some of the other fields? So it's much more prevention oriented, and we'll go into that framework a little bit more versus treatment, which is what medicine is usually. What do people get sick of, disabled, or die from? Primarily. Again, we're talking about the determinants of health. What leads to people being homeless or hungry? They weren't born that way. So something that they were exposed to, which is what we call risk factors or protective factors, which we're all constantly exposed to on a daily basis in our ecology, the environment that we live in, affects our health. What are the critical challenges? So what are the barriers? What are the challenges? How do we address some of this? And then on the same flip side, what are the supportive factors? What are the protective factors? What facilitates growth? How do you do systems change? How do you create policies, right? So like the education system, you guys are all going to school, that's a system. So I've worked with like Oakland Unified School District, where they're actually creating certain policies or the curriculum or program, or the State Department of Education, where they actually develop the core standards, and you could influence those. So I've done some of that type of work, which is pretty amazing to be able to influence a system. And then how do we address these in the most cost-effective and equitable way. So one of the biggest things we talk about is equity, how different populations, different groups are affected differently. Okay, just by where you're born, where you live, where you go to school affects you differently. Okay, next. So some of the main messages of public health, and there's a reason why it's called public health, is that the health of anyone, anywhere is the health of everyone, everywhere. So it goes away from just looking at yourself. It's a very selfless way to look at the world. You're automatically looking at a community health. You care about your family's well-being or health. You care about the community you live in. You care about the world. So a person living in India, in Delhi, their behavior, if they're polluting the streets or the gasoline they're using, that's actually polluting the environment for all of us. So their behavior impacts the world, right? So it's you actually take a global perspective. Or the different things that we're doing here is impacting people at a different location. So you're in it as a collective. There's a whole framework called collective impact. Substantial equity issues remain. So we'll go into some of that. Equity right now is a huge issue. So things like racism, gender inequality, LGBTQ, class, looking at privilege and underprivileged, lower income areas, they're automatically exposed to a number of different issues like housing and economic and education opportunities are so different. So their life paths become very different just by the virtue of where they live and what they have, what kind of opportunities they have or not, right? So equity is a huge issue, which is beyond health, right? It's different groups affected differently. There still remains substantial emerging and unfinished agendas and issues. So again, there's a lot of progress. In the 1940s, 50s, we were very much into infectious diseases when we had the world wars. It was a very different ballgame. Chronic diseases have taken over, and a lot of those risk factors are preventable. And you guys are getting much more into physical activity and eating right and all of that, which wasn't the case 20 years ago. Okay. I used to work with nutritionists and all these guys where it was just starting and people were not, we were still eating fast food, still going to McDonald's, still, so it's changing. Significant progress, preventable. Yeah, so we'll go into some of this. Next. So health versus public health. This is where you get into individual versus collective. Health, there's a World Health Organization definition of health, is a dynamic state of complete physical, mental, spiritual, which is usually called the fifth dimension, social well-being, and I would add cognitive, emotional. Emotional is different than mental. Mental is your mind. Emotional is your feelings, okay? Spiritual is a whole another aspect. And well-being. So we're very much getting into well-being, which is not just absence of disease, but promotion of well-being, positive well-being, how you feel about yourself, more about things that we're not even sure how to measure yet. And this is a national set of indicators they're just developing on well-being, not merely the absence of disease. Public health is looking at what we as a society do collectively, which is where Hope Avenue, a lot of other nonprofits come into play, which are called community-based organizations, right? So group of people, a small group of people can change the world. And that's how, if you look at Mother Teresa or God, if you look at some of these amazing people who've done something significant, they started as 1 or 2 or 5 or 10 people and just went further with certain set of principles. That's all it was, right? It was their conviction to assure the conditions in which people can be healthy. So the conditions, the environment, the behavior, access to education, access to healthcare, access to parents. Okay, these are things a lot of us take for granted, but a lot of these things are denied to many. So where you live, where you go to school, where you grow makes a difference on your collective health. That's what public health is. Okay, so it's a very broad field. It's science and art, and it really is. So I've been a researcher, community-based researcher for 25 years. I worked with government systems as a researcher. So I've been doing research studies. I've gotten funding from federal US Department of Health and Justice and Education, right? Which is very science. It's very scientific. You're going through research methods, research reports, publishing papers in journals. But the art of it is, how do you deal with the systems? How do you strategize? How do you create policies, which is the other arm of what I do? Okay. How do you engage community, which some of your projects are about, distribution of information, but it's not just information sharing, it's engagement, and there's an art to it. Prolonging life and improving quality of life through organized efforts and informed choices of society organizations. So again, it's so the onus is on you, right? It's not somebody else is going to come in and change the world. It's you are the change agent. So, and again, we're sitting in very much a bubble here, but if you work with some of the social entrepreneurs, so social entrepreneurship right now is a huge field that combines business and public health and sort of number of different things, public and private sector. Even the technology sector is in it. I've worked with some of the social entrepreneurs in Mexico and Africa and India, who are, again, these amazing people, 30, 40, 50-year-olds, who are leading organizations in change, just like half the country, right? So they're just people like us who've organized communities and government systems to come together for a cause, to change policies. And that's where the science comes. The more data you have behind it, the more powerful and more compelling is your sort of voice, right? The more people you have behind you, the more powerful it becomes, which is called community organizing. That's, again, a field within public health. Analyzing the determinants of health and the threats it faces is the basis of public health. You've seen this with COVID, where you're looking at data, who's infected, where our Hispanics and African Americans, lower income communities have higher rates. The vaccinations rates are different. That's data. You're looking at determinants of health, right? Health is COVID. COVID is impacting who's dying, the death rate. Death rate is a health indicator. The vision, by and large, if you go into any of these fields, is creating healthier people in healthier communities. And it's very broad, usually. Healthier children, healthier youth. The school system is all about that. Healthier, more thriving, more educated, better prepared, living your full potential. So it's about reaching sort of that level. It's all healthier along those lines. And the mission is how you do it, how you get there. This is healthy people. This is national vision and mission, United States. But anywhere you go, you look at the WHO website, look at United Nations website, it'll be very similar. It's just, it's global. Okay, it's global health, healthier countries, healthier developing countries. Medicine versus public health. This is a huge thing. People spend years. I worked a lot with doctors and nurses, public health nurses over the years, becoming a medical doctor. And the difference, primary difference in medicine and public health is medicine is after the disease has happened, they've been hospitalized, a doctor comes in to treat you. It's one patient at a time. You're saving lives. It's treatment after the fact. Public health is a prevention mode. It's more universal. So we'll go into the sort of the triangle. It's preventing disease before it happens. and you're saving lives literally in the millions. Okay, you're changing policies, national policy, education policy, welfare system, so many different policies that are created on a regular basis, global. So you're actually impacting the lives of all, like for instance, they just signed, I think, an infrastructure bill in the White House, right? A couple of days ago. That's going to impact the whole transportation industry. That's public health. Okay. So you're impacting millions before disease happens. Next. A lot of people, I just want to say, do MD, MPH. So you could become an MD with a master's in public health for 1 year. So I think just keep clicking on this slide. So these are all the different things that public health you get into. And again, it's very linked to Hope Avenue. You're getting a gist of what it is through Hope Avenue, right? But ideally, you guys would go work in the health sector. You would go work in the education system. You would go work in criminal justice, juvenile justice center. So go back a little bit, Shreya. So, oh, is it only coming one at a time?
Would you like me to go to the beginning, like the very first?
Yeah, I think this slide is kind of, it kind of puts, it goes into the specifics of public health. So public health breaks out into epidemiology, which is the science and research side of things. It goes into community health, which is more about health education in the community organizing and things with the community. It goes into policy, health policy. It goes into health administration. If you want to be running health systems, like even hospital systems like Kaiser, you do health administration, etc. It's about preventing epidemics and the spread of disease. Okay, that's the virus on the right. Environmental hazards. So the whole climate change, climate health is impacting health of millions. That's a public health issue. And I actually did my master's in environmental epi for a while before I went into more social epi. Promotes and encourages healthy behavior. So all of your individual behaviors, which we're now much more aware of by the virtue of the internet, that's public health. But you're not looking at just one person's health. You're looking at all your friends. You're looking at within your school system, the youth health, right? What percent of the youth are eating 5 vegetables and fruits a day? What percent are exercising 20 to 30 minutes vigorous activity every day, right? So you kind of measure it that way. Next. Injury prevention is a huge area. If you go to any of the emergency systems, homicides, a lot of them are spending on injury, treatment of injuries. Falls among seniors, that's a huge issue. So this kind of shows you from CDC, it's a slide sort of how you track down epidemics, how you look at who was carrying it, how it spread, who was exposed. This is sort of the process they go through. Even when this started in China, this is sort of the process that they went through, from which agent it went to who and who carried it to where. So there's a whole science behind it. Next. Yeah, quality and accessibility of health services. This is huge. So you do a lot of data collection in this. I used to work at Brigham Hospital in Boston for a while. And again, you look at quality of healthcare, access to healthcare that varies by race and income. This is the public health triangle. Okay. On the bottom, so it's primary, secondary, and tertiary prevention. Primary is universal. And on the right-hand side, you'll see sort of a lot of the schools now have counselors. That's a public health. How those guys got funding, right? They're impacting mental health of students. More community-based type sort of programs are primary. Secondary is if you have some risk factors, like if your parents are divorced, or if you're working in some sort of a specialized community etc. You have some exposure. And tertiary becomes very small, only very few percent, probably 5 to 7, 8% of the population is usually dealing with tertiary prevention. So these come into play. Let's say a person gets treated in a hospital by a doctor and they go out, most likely they're going to come back for the same illness, unless there's secondary or tertiary prevention happening. So unless they're getting some sort of physical therapy or changing their health behavior, so then the tertiary prevention comes into play. Okay. Worldwide, one of the things we look at when you do public health or any kind of intervention is you first have to look at the target population. Who is it that's going to be impacted? What are their risk factors? What are they exposed to as a group or as a community or as a family or as a hospital system, right? If you go work in prisons, you want to look at what are their risk factors. Now you have more and more women who are getting into the prison system, especially in juvenile justice. And because girls are, again, perpetrating. They're going from becoming a victim to now becoming a perpetrator, right? Because some of their risk factors haven't been addressed. So yeah, this gives you the breakdown of the countries. And then next, I think we can go into some of the other things here. Yeah, so it's important to look at how many people you're impacting. So 2/3 of the population is in Asia. Even though we're sitting here, guys, by the virtue of the internet and everything that's becoming digital, you actually have the power to influence change globally. Okay, and that's what my consulting firm is, DNA Global. We work with organizations on human trafficking, child labor in India, doing stuff outside of just where we live, because I could have staff sitting there. I could work with nonprofits who are on the front end there and provide them support sitting here, right? We can do the research here. We can do the grant writing here. 1/3 of the population is youth, and they're growing. So your generation, I would encourage all of you guys to go on United Nations website, WHO, CDC, just for a few minutes, and look at the health statistics. So you can see where sort of the world is in terms of health and happiness, right? Some of these sort of broad indicators. You guys are the hope, to be honest. When public health came about, I figured out public health after my bachelor's. I got my bachelor's in biochemistry with a minor in environmental toxicology. And I did biotech for 3 years after that. But it was after that where it was, I want to make a difference. Don't want to go into medicine. I didn't want to do clinical. I didn't like hospitals. Okay. But I wanted to make a difference at a large scale. And so I was lucky enough to have found public health. But you guys, I think at this point, it's much more evolved. You can get undergrads in this and all of that. Literacy rate has improved. That has direct implications for poverty, people living in poverty. That's huge. I mean, we can go into some of these. People are moving more towards urban. Again, younger people tend to live more in urban cities versus more rural areas, etc. And 30% are either under or unemployed in developing countries versus 4 to 12%. So our unemployment rate has increased during COVID, which is usually 5, 6, 7%. Okay, that has huge implications on your health. That's a social determinant of health. Education and employment are root causes of health. So if we want to work on homelessness, we want to work on, we're just giving them food, and which is sort of, again, after the fact. If we really want to help these individuals, you want to help them with training, giving them skills. Some of what our mentoring group is doing, for instance, teaching them computers, things like that. Okay, next. So Vi, jump in when I don't know what slide we're on. Okay.
We're on slide 10 right now, but I'll jump in on both sides.
Okay. So for this, the root causes of poverty. Sorry, so you guys want to guess in the chat, what is this presentation of? Okay, so take a look at it and look at the full picture of the person on the right and person on the left. Yeah. That's right. Rich get richer, poor get poorer, because there's a thing called investment. Yeah, so I think it's pretty self-evident, right? So the person on the right might be more educated. And if you're growing up poor and you get education, higher education, high school diploma, college, bachelor's in college, right? Bachelor's, you have, the rate of going for out of poverty is much higher the more educated you are. It changes your chances, life chances for success, which again is not a given for a lot of people. So you guys are very much where we're living in a bubble here because you're not exposed to all those other types of folks where education and employment, they don't have access to education. This is, again, we're not even getting into developing countries. Ideally, we would be doing mentoring and tutoring, just that in itself for kids who have to walk miles to get to a school, right? And girls in many countries can't go to school, right? So I don't want to go into some of the rates, but it's pretty horrendous what they go through and what the expectations still today are. To get married at, child marriage is a huge issue. Human trafficking is a huge issue. The girls are getting younger and younger. So gender inequality is huge in the world. 50-60% of the women have experienced abuse, and it's much more prominent in developing countries. The laws are not there to protect them to begin with. So you really have to look at the root causes of all this. Next. Provide basic needs. So this is where we are coming in through Hope Avenue, right? Is being able to provide food, some of the drives that we're doing, some of the clothes that all the donations that we do, those are very helpful. The veterans that we're working with, those needs are not going anywhere. But what I want you to understand is the root causes of those. So ideally, we would do as an organization a lot more, right? Our capacity and our impact, our drives, we could ideally go national with it. If there's a way to raise funds and have certain organizations that we could support, that would be ideal. And we want to be able to address education gaps, employment gaps, and computers and math and sciences, all the stuff that you guys are learning so much earlier. Use your computer skills to help nonprofits develop computer systems. And Stanford has a thing called, I think it's called Startup X, something like that, where they have a bunch of sort of techies come together with the social sector. And you design sort of apps to help nonprofits in the developing countries, right? I've attended some of those, very exciting stuff. And then they try to get funding from some of these big companies to support those efforts. Yeah, next. Why is global health important? So it's very important to look beyond yourself and take care of yourself and then look outside of yourself. right? Because it impacts the productivity. If you don't have your health, health is number one. You don't have your health, you can't go to school, you can't learn. There's a lot of kids who come to school hungry. And again, that varies by school by school. There were some schools in Oakland Unified, 70-80% of the kids did not get breakfast. Okay, they can't afford. They were living below the federal poverty line. So it was very important for them to get free and reduced price lunches. Because if you're not eating at some point 11, 12, you're not going to be able to learn. You just can't concentrate. If you have abuse at home, it's going to have impact on your mental health. At some point, you're going to fall through, right? And that's what happens to the kids in juvenile justice system. It's not their fault. They're just living in an environment, and that affects their productivity. Links to economic and social development. The unhealthier a country is, unhealthier county is, city is, that just means percent of people in that city that are calling in sick, the less they're going to work, the more healthcare costs will be, right? So all of it is related. These are risk factors for outcomes that have outcomes, impacts that are at a larger level. It has implications for security and safety and freedom. That's where violence prevention comes into play. That's a huge issue. It's because people are unhealthy, they're drinking, they're getting into car accidents. All these things are related, and each one of them is a huge factor. Yeah, expenditures, lack of respect for boundaries. A lot of the times we end up coming up with, we'll go into that next. Yes. So one of the things I've mentioned before as well, is to question. Read. There's so much out there. You want to know the why. Why am I doing this? Why are there people homeless? Why don't they have a place to go? Why aren't there enough shelters? Right? Why is there a gap between the rich and the poor? So what we know is that there's enough to go around. It's just that there's gaps in the have and the have-nots. And so the issues come into play, the mental health, the physical health, the economic, all of that is related thereafter. So it's very important to ask the fundamental assumptions. And the assumptions are, a lot of us live by blindly. The culture and the conditioning is usually what we're sort of assuming what the norms are. We're all kind of living by the norms that have been created for us centuries ago, including the education system, for instance. So it's important to start questioning, why things are the way they are and what can we do differently, right? Yeah, next. Yeah. Yeah. So all those questions are very relevant, right? It's not about if you have $100, how do you spend it? That says a lot about who you are, your character. How do you spend it? You give $100 to a nonprofit in India, that $1 could be a month's worth of food for a girl in India, right? Versus a $1 here. So the cost benefit, so there's all these other factors that come into play. The health of the world, and this is, I think, Vi, you want to take over for a few minutes? This will go over some of the statistics of where the world is. And again, these are the kind of things that I've analyzed as an epidemiologist. So I just want to give you actually combine statistical analysis, mathematics, science, computers, all of that is part of what you do in this. It's just your goal is to help improve the world. Okay.
Yeah. Okay, so like Ms. Sonia said, now that we have an introduction to public health, let's take a look at the health of the world, sort of an overview with the lens of a public health worker, right? So the first statistic we're going to look at, we can all agree it's incredibly relevant and important, is the average life expectancy. So if we take a look at the graphic on the right, the first year that's shown is 1900, And we can see that the average life expectancy was 47.3 years. And 96 years later, it was 78.1 years. And that is an insanely large jump. And public health efforts are responsible for 25 of the nearly 30 years of improved life expectancy. And it's important to note that this is in the United States, and it was from 1900 to 1996. Okay, now we're going to take a look at the top 10 causes of death in the US, a little darker. But just to give you guys context, this is for the year 2011. And in order, it goes from heart disease, cancer, chronic lower respiratory diseases, stroke, accidents, Alzheimer's disease, diabetes, the flu and pneumonia, kidney disease. And unfortunately, the year 2011, suicide was new to the top 10.
Yeah, let me just add something to this. So all of these are preventable. Okay, and if you look at these by age group, by race, so suicide rates among youth are increasing. Mental health issues among the youth today are on a rise. That's huge. So it's very important, whatever you're doing, to put that in context of this. Heart disease is preventable. Physical activity, exercise. So it's important to look at the root causes of how you can prevent some of this.
Right. So a lot of these causes can be prevented by public health services and programs. So it's really important that this data is sort of analyzed and properly understood by taking a look at the root problems. Okay. So here we are talking about the leading causes of death, but we are taking into account socioeconomic statuses. So we are going to be comparing the causes of death for individuals from low income and high income. So for the low income individuals, the leading causes of death are respiratory infections, HIV or AIDS, diarrheal diseases, malaria, stroke, heart disease, and TB. And for high income individuals, it's heart disease, stroke, Alzheimer's disease, lung cancer, respiratory infections, COPD, and colorectal cancer. And it's important to note that this was in 2015. But in the chat, can you guys notice any large differences between the types of causes of death between the low income individuals and high income? Any observations? Do you guys see any differences? And if you notice any differences, could you explain potentially why there is a difference?
Or just speak up, guys. Just unmute yourself and share what you think.
Well, in the low income category, there's like a lot of 5 different reasons above heart disease. And I'm guessing that all of those are preventable using money, which high income people have, but low income don't.
Exactly. That was a perfect explanation. Of course, there may be other factors in a low income individual's environment. They may be leading to the difference in ranking. But I think that was a perfect way to explain it. Miss Sonia, do you have anything to add?
Yeah, so this is low income countries, right? So one of the things you want to get away from is blaming the victim, so to speak. So instead of saying low income individuals, it's low income country. So they're living in certain conditions in a low income country like India, like developing countries, where climate issues might be huge. So certain behavior or conditions or environment, pollution, right? Things, the substances in the food, the farmers, all of that they're being exposed to, so respiratory infections are greater. The medical system might be different in India versus the access to medical system in the developed countries. So as a country, diarrheal diseases are infectious diseases. Again, it's pollution related. A lot of it is access to toilets, access to, right, clean homes to live in. So you have to look at the environment that's sort of predisposition to what they're exposed to, and so they're ending up with, which is a number of your individual behavior within the context of the larger. But yeah, that's a great example.
Okay, so recent health threats in the United States. First, we have COVID-19, fires in the US and Amazon, tsunamis, hurricanes, for example, Sandy and Katrina, the Salmonella outbreak, the H1N1 outbreak in 2009, and the 9/11 attack. And I think something I noted here was that the last bullet point may seem like it doesn't fit in this list, right? But it's important to note that threats aren't necessarily only diseases or infectious or natural disasters.
Mhm.
It could also be from, humans or political organizations. Anything that's considered a threat to the general public also falls under recent health threats.
That's right. So political science has implications for public health too, right? So terrorist attacks, religious organizations, any way the world has chosen to divide us, whether it's geographical, whether it's your race, whether it's your religion, whether it's the color of your skin, those are all humans have created these strata to divide us, right? Ultimately, we're the human race. And again, all of these, 9/11 is violence. Violence prevention is a public health issue. I spent years on violence prevention. Now I'm more into resilience and thriving, which is peace. How do you build peace? So promoting more positive and not just looking at violence prevention. But yeah, these are public health issues.
Okay, so now let's take a closer look at some of the health threats that we looked at with a public health lens. So Hurricane Katrina was the second strongest. It mostly impacted the Gulf Coast and costed them $110 billion. The storm surge was 20 feet, and the greatest number of deaths was in the New Orleans, as it flooded 80% of the city. And as a result, it affected 90,000 square miles. And taking a look at the very recent COVID-19 pandemic, it was very quickly considered a worldwide public health emergency. And the symptoms depend on the age of the victim, and if they are immunocompromised, that also affects the severity of the symptoms. And some of them include mild to moderate respiratory illness, fever, cough, shortness of breath, muscle pain, and sore throats. And depending on the individual, they can start experiencing symptoms 2 to 14 days after exposure. And the way we just addressed both of these health threats is extremely important. We basically looked at the big picture and we addressed all of the aspects of the what, the why, the how, the who, and the where. Not only is identifying the recent health threats important, but also the way it's analyzed is extremely, extremely important.
Yeah, and how the communities and the systems come together to address it. So how the healthcare stepped up with the COVID-19 is phenomenal. How the biotech industry came up with the vaccine in less than a year, that's crazy. It takes 6 to 7 years to develop a vaccine. If you work in biotech, if you go into any of the biological sciences, it takes forever to go through phase 1, phase 2, phase 3 clinical trials, and they've rushed that within a year. So it's amazing how different systems have come together.
Right. Okay. So now let's look at some positive statistics. 42% increase in global life expectancy. There's been a 50% fewer deaths among children of ages 0 through 5. And there's been a 44% decrease in maternal mortality.
And I just want to say those are mainly in developing countries. So children 0 to 5, infant mortality is the #1 cause of death for children in developing countries because if they don't get access to prenatal care. It's huge. And same thing with maternal mortality. That's still very high in developing countries.
Okay, so now we're going to go into risk factors. And looking at this graphic, I'm just going to run through them. We have social and economic status. And like we looked at it before, we compared the low-income countries and the high-income countries. Next, we have health status, disability, race or ethnicity, gender, religion, occupation, where you live, and social capital. And there are numerous other risk factors, but it's important to take these into account because they help us understand an individual's environment and the specific threats they may be experiencing. And then the next slide.
Yeah, I can go into this.
Okay.
So some of the risk and the protective factors are not just at the environment level. Environment, we're looking at broadly in terms of community, society, relationships, right? So anything in your environment, within your school environment, your classroom environment, your relationships, peer environment, the country you live in, your culture. A lot of you guys might be biracial, right? You're Indian and American. That's environment. That's part of your environment. And then you have individual characteristics, your individual assets, your agency, your own characteristics. Those are also factors. The color of your skin, your gender, the class, your family dynamic, all of that is within the individual. And those affect your health outcomes, essentially. And if you group them together, you group a few kids together, or community together, you could look at Danville, for instance, 50% of youth here are healthy, or, whatever. So we can look at sort of health outcomes as a city or as sort of an area. And I am very big on protective factors, right? So majority of public health and in general health sciences, we focus a lot on risk factors. Risk factors are usually 30% or less. This is a very deficit-based model. What do you lack? What do we not have? What's missing? Whereas 70% of even the person who's homeless has certain assets. They already have certain skills. They already have resilience. They might have connections. So how do you identify their assets and help build those? They might have a family member, right? Same thing with like anything. Relationships are connection. A lot of us got through COVID because we were connected to a few people, right? So you have to look at protective, what protects you, what supports you, and then help build those further. That's much more powerful in terms of impact on certain health outcomes for an individual level outcome or a community level outcome to build protective factors.
Okay, so let's put these two concepts into a real world example. So some of the risk factors could be the isms, systemic racism, a long history of racism, institutional and individual racism or discrimination. And the protective factors for this situation could be the Black Lives Matter movement, or an individual could have supportive and caring relationships. They could have access to meaningful opportunities, high expectations, and the practice of celebrating unique differences could be the protective factors.
Yeah, so celebrating differences is a huge one. Right now, we talk a lot about equity, inclusion, and we have one of our internships in that. That's a huge thing in the field right now. A lot of organizations, even Google, Facebook, all of these actually have positions for an equity officer, right? And they want the whole organization to be more equitable. You have very few women in the tech sector, even today. So how do you level the playing field? That's building equity. And so again, how do you recognize each other's differences, not expecting everybody to sort of follow the crowd, but identifying those and celebrating those differences versus sort of undermining those. Yeah. Yeah, each of these is huge. Economy has huge impact on public health. So if you go into economics, which again, one of the things I wish we had more time to talk about some of this. I think we need a lot more integration of fields. So if you go into public health or psychology or computers or whatever you're sort of leaning towards, take courses in some of the other fields. Understand economics and what that means. Take a course in entrepreneurship and how to, develop solutions that impact change at a large scale. Take a business course, right? Take financial management, take a computer course where you can develop an app that has implications for a health system. So all of these are huge. Where you live is geography. Culture is huge. Again, cultural norms is the elephant in the room that we never talk about. Okay. There's certain cultural norms that are so ingrained that we've been living by for centuries that I think need to be challenged big time. Why do we do the things the way we do them? Whether it's religion, we're much more common as a human race than different. And yet we've highlighted our differences for some reason a lot more. Same thing with economy. Education is huge implications, huge. That's a root cause that we definitely need to get a lot more life skills in there, a lot more, mental health education needs to be in there, a lot more meditation, and some of that, how do you go more inward, needs to be part of the education, etc. Okay. What can we do about it? Okay. Yeah. This is all of the above. So everything and anything you could think of, what can we do about it, right? So from feeding the homeless to clothing, to teaching, to mentoring, to changing policies, to creating healthier mothers. My God, each one is a huge thing. Motor vehicle safety is huge, especially among the young people. Wearing seat belts was a huge issue. People did not used to wear seat belts. Drinking water, that's a huge policy issue back in the day. Healthier babies, again, 0 to 5. There was a smoking tax on cigarettes back in the day, and every county created a first 5. And they ended up, every time there's a birth, there's about 20,000 births in every county, in Alameda County, Contra Costa County. And each of those parents for the first 5 years, you get sort of a kit. They send you like what to expect and, all that stuff. But again, the chances are higher for special needs kids in lower income areas. Etc. Access to food, healthy food is very limited in parts of Oakland. You get fast food and liquor stores for like 10 miles around you. So, yeah. These are some of the ways you could address enabling healthier foods and more exercise. Now, each of these are fields. So what I'm trying to say is, nutrition, becoming a nutritionist, or physical activity is a field in and of itself. You could go into sort of a population level change if you're interested. If you're into sports, there's sports medicine, but there's also sports in terms of healthier athletes and, more broader scale change. Same thing with cancer. There's cancer prevention. Where's the cancer coming from? There's research behind it. Alcohol, tobacco reduction, drug use, that's a huge field. All of these are sort of ways to address. Okay. And again, the ways to address are community level change. It's awareness, shifting mindsets. It's information sharing. It's challenging the norms. It's systems change, whether it's healthcare system, education system, the workplaces, those are all systems, right? Yeah. Yeah, let's go into this. So is this a question we want to ask everybody?
Yeah, so I think the first statistic we jumped into was the extended life expectancy. So now that we've sort of gone into more of the specifics, if you guys want to take a stab at it in the chat, I mean, you don't have to give all of the reasons. I don't think we ever could. Maybe each of you could sort of put one thing in the chat that you learned. How do you think public health has helped with extending the life expectancy? maybe each of you just one thing in the chat.
And there's no right or wrong answer, right, guys? So this is, again, or you can just talk about it.
Yeah, feel free to unmute or put it in the chat.
So one of the biggest change that happened from 1900s, earlier 1900s to now is we've gone from infectious disease to chronic.
Right, so in the chat, we have better nutrition. People are more aware of current health issues and how to prevent them. More knowledge and research being put into it.
That's right.
People get educated on it. So I think the last two are very similar, definitely. Yeah.
Yeah, we have limited time. I know it's 5:58. So this is where some of your internships are, sort of. The reporting, the evaluation is looking at when we do the annual report, what we did, how well are we doing it, what difference are we making? Monitoring is also data. So all I do is data, right? A lot of my work is data. Storytelling is data. Telling a narrative is data. These are the essential services. If you look at a state level, national level, WHO, city level, so any kind of levels, they usually serve these. If you go to a county public health department, these are sort of the areas that they're looking at. And informing, educating, empowering. Empowerment happens a lot when you're engaging, right? It's information sharing, but then also engaging, asking the questions, talking about stuff, which is what I wish we would do a lot more of. Have some forums to be able to talk about some of this, show videos on some of this. I think it'll just blow your minds when you start looking at some of what United Nations youth are doing at a global level. Partnerships. No one person can do it alone. I can't do it alone. Vi can't, you can't. But if we come together, right, and we partner with 10 other organizations or school systems, we can change quite a bit. We can raise, we can do a lot, okay? We can change systems. Same thing with policy change. If we identify one or two policies, like when we had the elections last year, the youth over 18 voted, that made a huge difference. More youth today are much more aware of the policies and the damage that happened. And so they voted probably more Democrat than Republican, right? And that made a difference in sort of what's happening today. That has implications on all of our lives, etc. So all of these are ways. The competent workforce is where you guys are headed. So now you're getting into more broader fields. Again, integrate. Don't stick to one thing only. I would encourage you to sort of explore this and do an internship here, try this. I did that for years. Those are some of the, most amazing times. Work with a doctor, but then also do research, right? Research, you get the bigger picture. Why, what, how do I change the whole thing? If you're more of a thinker, do that. But then also you can see the front end by working with a doctor or a nurse of how to do service, etc. Okay.
Okay, so I think we hit 6 p.m.
Yeah.
But we had an amazing webinar. Thank you so much for those of you that unmuted, for the guys that were interacting in the chat. Maya, really fast, do you think you could screen share the second to last slide before we head out, or you guys could even do this after we end the webinar? I just want you guys to participate through this Jamboard. So after going through this whole webinar, I'm sure you guys have thought about how you guys as an intern, how are you supporting public health, right? Because you guys are working with a nonprofit, you guys are interns. And like Ms. Sonia said, some of our roles, some of our jobs fall under these segments of public health. So I'm going to share a Jamboard in the chat. And right now, really fast, or, if you guys got to go, you can do it later. Just share one thing. I really want each of us to share one thing. It can be anonymous. And then we can share it with the rest of the group at our next monthly meeting, which will be on December 9th, the Thursday. Sharia will send more information about it later, but I hope you guys got a lot from this webinar, and I hope you guys come to the next one. But if you guys have any more questions, you can stay back or you can Slack Miss Sonia. But again, please fill out the Jamboard when you get the chance. Slack us if you have any questions, stay back if you want to. But I think that's pretty much it. Miss Sonia, did you want to say anything?
Yeah, so I would encourage you guys to reach out to me directly if you want to learn about any of this, or if it sort of put a seed in you at all. So even though you're kind of starting small by doing volunteer work, or you're seeing it as sort of, it's actually a whole field related to many other fields, right? So I would encourage you to kind of think outside the box a little bit more. Think of like I said, question the fundamental assumptions, and ask why, who's impacted, how, why. So whatever internship group you're in, that was the whole purpose of the work plan. How can we make a difference this year for a small group of people out there, right? So through your internship, how can you make a difference? How can you look at data differently? How can you engage the community differently? How can you empower youth differently or create healthier youth? Is there an issue that impacts youth today that you'd want to have more information out there for? So I would encourage you to sort of go beyond and sort of be that change agent in some small way this year. Okay, so but don't be hesitant to reach out. I've worked with youth for many years. I'm happy to chat. Okay. Thank you, guys.
Thank you guys. See you guys at the monthly meeting.